her inability to do this with you. Okay. All right. So.
Much better.
Yeah.
Yeah, you still use your ankle.
Like try to.
I know.
It's hard to do this motion without supination and eversion. It's a really difficult one. I'm not so worried about their ankle unless they have an ankle dysfunction that's driving this, and I can see they can't dissociate. But mostly I'm looking at that hip, because if they're trying to compensate with that might be more of an issue. But yeah, I mean, technically you don't want to, you just want pure rotation.
So we're gonna say that you're probably well, probably wrongly.
So,
Right?
now that we've discussed that, can you hop on back here? So we're gonna do we're doing motor control breakout. So I want to do throughout range, injury, or dissociation, coordination at the knee. Okay.
Oh wow.
Okay. Can you lay back for me? Okay. So I want to see your ability to move your knee as you're moving both into flexion and into extension. Okay? So can you bend your knee for me? Okay.
Oh, we
A little bit more.
Clarify it just a little. Yeah.
Okay. And can you straighten it for me? You have a range of motion issue now.
Yeah, but okay, never mind. Everything's fine. I can do it.
Okay. Okay. So as she's bending, her knee, I want her tibial, internal rotation. So can you go ahead and do that again for me? Okay, that was good. And then with extension, I want external rotation. Okay, that looks good. Can you bend your knee for me again? Can you do one? That's it? Okay. All right, so we're going to be focusing on your inner range. That's what you seem to be having trouble with. So this could be one of the exercises that you're doing, holding your knee into inner range. So are you fatigued here right now? No. No? Okay. All right. So this could be one of them that you could be doing. I also want to assess dissociation and coordination of your knee. I'll explain to you what I'm doing as I'm doing it. I know it sounds complicated. Can you do me a favor and can you stand up for me?
I just have one question.
If you want me to talk, I was going to give you feedback at the end. Do you want me to interject?
yeah.
Okay.
Okay, then afterwards I'll ask.
Okay. So we're just going to do a single leg stand. So I just want to see your ability to control your leg.
So do I stand on this?
So just stand on this leg right here for me. Are you going to hold it there?
Yeah.
Do you feel fatigued? No?
No.
Okay, fine. Okay. So I would want to have her do the single leg stands first. Just for, does this feel like a challenging challenge to you? If it's long enough, yeah.
Sort of.
Okay.
Yeah, if it's long enough, yeah.
Okay, so I would see if she could do this 10 seconds, 10 times, and just hold it for 2 minutes without having any type of compensation. We're good? No?
Good job. Don't put anything else on it.
Yeah, I can't think of anything else right now.
So your 2 exercises that you're going to give her, what are they?
So the first one that I would give her is having her do, so that same thing that we were doing, you're just gonna do the pull, and then slight flexion, so it's up and out. Okay, your knee, remember your knee slightly flexed. Good, and up and out, good, and then you're gonna practice doing that as you're taking a step. Okay, so you don't have to go that way. Oh, it's just as if you're going down the stairs.
At this much.
Alright, good. And then the second exercise I would have her do is just do the single leg stance on one leg, making sure that she sees no compensations or gives.
So on the rubric, identify the participation limitations, the activity limitation, body structure, and the pathomechanical, which you kind of did throughout, but you're going to be expected to summarize it at the end.
Okay.
The other thing is you didn't take her shoes off, particularly when you tried the ankle correction.
Okay.
It's at that point usually people realize they should have taken the shoe off. If you take the shoe off at that point, you kind of have to reassess everything because you've just changed the system.
Right.
So you should start with shoes off, unless they come in saying, when I do it barefoot, it's fine. When I'm in these shoes, when I wear shoes for some reason, it's an issue. Then you're like, all right, let me assess you in your shoe. But yeah, most likely you're gonna at least see if you can replicate it barefoot to see. Your choice of functional test was fine. I would have gone with a single leg squat because it would have been easier for you, especially with them stepping forward. It's hard to do an ankle correction when they're stepping forward. So stairs are, like you asked the appropriate question of, is it the top leg or is it the bottom leg? But it's still a single leg squat. It's just that the top leg you might be more back. The forward leg you might be a little bit more on top of it, depending on how you want to say stairs are. But I probably would have done have her hold on, single leg stance, because that's more mimicking the walking downstairs. And you didn't tell me what you were looking for. Active equals passive, give her deviation.
That's what I was gonna ask you, when I
Yeah.
was finally laying down here.
Either of them, it's the breakout and functional.
Okay.
You'll probably be asked, what are you looking for? I wanted to see if I want you guys to be so on it that you just state it.
Yeah.
But if you didn't say it, I would have said, what are you looking for? But I want you, when you're doing it, to say, I'm looking for, does active equal passive, and what gives might you see? And then I would have told you what give you had, or had you noticed valgus or this and that. For her, Sandra was acting out pain, so you knew that that's what you're looking for. The person on the practical won't. So I need to hear what you're doing and what gives might there be at the ankle, at the knee, at the hip type of thing.
Say active does not equal passive and also there's a give. Where do you just still stabilization?
Yeah, you're still going through it, it's just you're noting in your head, especially for your notes and for your post-test, what's going on. Because you might clear the pain, but the movement dysfunction still persists at the end, and then maybe there's two things going on. Usually we address pain first. If there's no pain, we address asymmetries and movement dysfunction. But your first thing is get somebody out of pain. Their movement dysfunction may still exist, but you might give them stuff so that the pain goes away, then when they come back, you can fix the movement dysfunction. So you're just noting what you see and prioritizing what's the important. Because you might see it and give it the ankle, give it the hip, and give it the knee, and then the one at the knee is what takes the pain away, but the movement's not really that great. You're still focusing at the knee.
Okay.
It's just it's your clinical priority.
That's what I wanted to ask you, because remember you said like now it's becoming a range of motion issue, would you still at that point be like, okay, well let me apply some more pressure and see if it actually does equal passive?
I'm just thinking like, at that point you already know. Cleared, because we've done the screens already.
Yeah, maybe not, because you may have done it in a different position.
And this is when you're talking about you're still gonna reassess that driver assessment.
Yeah.
Okay.
Yeah. And you need to check active equals passive, or is there a benchmark? Because what is it for a normal squat, it's about 70 degrees.
Yeah,
For a
50.
single leg, it's 50. Yeah, I can't remember if it's 50 or 40. So had you done a single leg, your benchmark would have been 40. It would have been 50. I'm always going to say 40. You kind of did like a lunge. I don't think we may or may not have a benchmark for it. So just come back to the ones that we've come in class. But your assessment wasn't wrong. I just think it was a little bit more difficult than it needed to be. Especially, like I said, when you were trying to stabilize their ankle as they're stepping forward, your fear is going to be that they're going to step on your fingers. You're not going to be doing that great of a stabilization.
So that's why you said single leg.
Yeah, because then you can get your hands under there and stabilize. It's a little bit more controlled for you.
Also another question, we learned in basic that you don't want their shoes off at all, I guess, when you're doing the practical, because they could not be for point in terms of safety. Are we allowed to do that here? I just wanted to
That
know.
was a huge
Yeah.
thing.
That's what I think
They
that's
were
why
like,
nobody
you will
takes
fail
off the
if
shoes.
your shoes are on.
Okay, so that's good to know, because then we won't knock you for not
Yeah,
taking
so if you
shoes
see a
off.
lot
Is
of
that-
people without the shoes, like, who don't take off the shoes, I think that's the reason
That could be.
why.
Okay, so maybe it's worth saying like before.
Yeah, Dr. Rodriguez was
Because
just
you guys are
like,
laughing
is
because
it
we got you a lot on that one. You didn't tell us you were
No,
taught not
that
to.
was like the same miscommunication.
Yeah,
Last year.
yeah.
And we just learned as a class that each class is different.
No, you need to tell us that you're learning different information because we don't know. Now this makes perfect
Yeah.
sense.
If the
Because we
patient's
were like,
still
why is no one
shoes.
taking shoes off? You guys should have told us.
Because that's a
So are we
safety
allowed to?
problem.
Yeah.
I think safety is automatic.
But it's not-
automatic.
Yeah, it was an
Yeah.
automatic
Yeah.
fail.
It's a
so.
safety issue if someone takes their shoes off and they're in socks. If you're taking someone's shoes off, the socks have to come with it.
But then it was like
And
a whole thing of like, if you have them stand up again, you need to put their shoes back on. And we were like, that takes up so much time.
Yeah.
Yeah.
So it really depends on who your proctor is. Like,
It
I
does,
have
and
Dr.
that's
D
not how it
socks
should
with,
be.
like, gripping. Yeah.
Well, no, they told us
Probably,
Dr.
but
Rodriguez was
I have
like,
to-
explain everything you're doing
Yeah.
and tell the person, is it okay?
Because they were like, I guess the contraindications were like, oh, the patient might step on something that they shouldn't have been stepping on, and then you get like a sue or something, and then
Yeah.
you're like, in your head, you're like, I'm never taking off the shoes.
No, that's just, well, I'm glad you guys are telling me, because this is definitely a topic I'll
that's
bring
something
into
I let
the
them take
faculty
off the shoes.
conversation. No, of course it is. If
Yeah,
you guys
I was
are
like,
learning
I'm not
that,
taking shoes
if
off.
you think I'm gonna fail you for it, then yeah, you're not gonna take shoes off. But in my humble opinion, if I'm having a patient take their shoes off and they're wearing socks, socks are coming with it. That is definitely a safety risk, because that's the
like
last
a
thing I
slide
need
on
is
the
someone
sock?
slipping in their socks, yeah. So I always tell them, like, I need your shoes off, which means socks too.
What if I
So
bring socks with grips at the bottom?
as long as you explain it, then it should be fine.
Okay.
Your therapist should say, I need your shoes off and your socks because I don't want you to slip and fall in socks. The patient can go, I have grippies on my socks, and then the therapist can make a clinical decision saying, let me see those. Oh, those look safe.
Okay.
I mean, it's fine for me, I don't know, but I don't think Dr. Rodriguez would have an issue with it.
Yeah, no,
But I'm
I'm
gonna
not
bring
like
this up in a
discrediting
second.
any
Sorry, guys.
professor, I just figured.
Take off the shoe for capstone.
Yes,
That's what we want.
shoes and socks for
Oh,
capstone.
really?
Yeah,
Yeah.
take it off for capstone.
Yeah.
Yeah, I'm not discrediting anyone, I just figured she'd understand why we don't take it off.
No, we as a faculty need to not do that. Have some communication. So I'm glad you guys are saying stuff like that. Because in the clinic, you will be taking people's socks and shoes off. Like it's absolutely a safety issue to just leave someone in socks.
Right,
But
like, we learned that we can take their socks and shoes off, but that's if like they're sitting and not walking around the clinic. If they're walking around the clinic, that's where we, yeah, right, isn't that how we learned it?
Yes.
Okay,
okay.
I just wanna make sure, cause I don't wanna say something wrong.
Yeah, no, I'll bring this up in the faculty meeting because we need to have a resolution so that you guys aren't being driven crazy. And don't go, because like if you go into a clinic and your CI is like, well, the socks and shoes should have been off, and you're going, well, it's a safety issue, they're gonna be like, no.
That's
You know,
definitely what's gonna happen.
Like
to
there's
me.
so many places that are carpeted and things like that you're like, really? It's a safety issue? I would laugh if my students, like at Aspire, how many times do we have people walking around barefoot? And it's like a dirty wood floor and you just sort of deal with it.
Anything else?
I think that was it.
So the
I think just make sure I had a question because